Just a few ground rules before we proceed. Please note this session is only for representatives of the media and is not open to the public. For those non-media members who are here with us today, we ask that you leave this session at this point. Thank you for your understanding. Alrighty. First, Dr. Vigilant will provide an overview of aerial spraying and an update on developments to address the rising mosquito population that is carrying the West Nile virus in our community. Then Dr. Brown will provide a brief update on the West Nile virus human cases this year in our jurisdiction. After that, we will turn it over to our media partners for any questions. Since this session is being recorded, we ask that all our media visitors kindly put themselves on mute during the duration of this meeting. Please use the raise hand feature on the reaction tab at the top of the screen so that we can take your questions.
I'm not looking at them, I'm gonna look at them, but I'm not gonna
Feel free to post your questions in the chat as well, and we will address them accordingly. We will be sharing a recording of this Q&A with those attending this afternoon. Before you present your question, we ask that you introduce yourselves and the organization that you serve. Please provide one question at a time so that we can give other media representatives time to ask questions. We can return to any other questions you may have if there are no questions from the floor. And with that, I will begin the recording and turn it over to Dr. Vigilant.
Hello, everyone. Welcome to this session. As mentioned, I'm Dr. Max Vigilant, Director of Harris County Mosquito and Vector Control. Dr. Brown is here with us today. Also, you get an introduction from Dr. Brown. When we're here to talk about our increasing number of West Nile virus human cases and our West Nile virus mosquito pools. What we are seeing currently is a higher number of mosquito pools compared to previous years. We are currently at 615 positive West Nile virus pools in 180 operational areas out of 268 operational areas that we operate in Harris County. One of the reasons that we are seeing an increasing number of pools is because we have improved our operations, improved our testing platform, improved our testing capabilities by using real-time qPCR compared to our ELISA platform the previous years. With qPCR, we have 5 times more sensitivity in terms of detecting virus in mosquitoes. With this, one of our pools contain anywhere from 1 to 50 mosquitoes in a vial, and we will test that via qPCR to get a result within 6 to 8 hours. So our turnaround time is quicker, our sensitivity is quicker, and we are seeing a better picture in the Harris County Mosquito and Vector Control mosquito population around Harris County in terms of what we need to do, what we need to see, what we need to protect residents of Harris County from mosquito-borne diseases. Currently, it's West Nile virus, and that's our concern. So this is where we are. We continue to treat areas that are positive for West Nile virus. We will treat those areas and the surrounding areas. And like I said, we're at 180 right now, which is, last time we saw that number was in 2014. So this is where we are currently in terms of mosquito-borne virus. Dr. Brown can talk about the human cases.
Thank you, Dr. Vigilant. Again, my name is Dr. Erica Brown. I'm the local health authority for Harris County Public Health and the Director of Community Health and Wellness. As Dr. Vigilant said, we are seeing an increased number of positive mosquitoes in the area. And because of that, we are also seeing an increase in human cases. As of today, there are 23 human cases documented, and 21 of those cases have been hospitalized. As we've discussed previously and in your media updates, West Nile virus typically, for most people, doesn't cause the need for hospitalization. There are many people who experience West Nile virus or get infected, perhaps have a fever, have some body aches, don't feel well, but don't know that they have West Nile virus because those symptoms subside on their own. Unfortunately, though, what makes West Nile virus a serious condition is the potential for brain swelling or encephalitis, and swelling of the lining of the brain and the spinal cord, a form of meningitis, which can be life-threatening. And that's what makes West Nile virus something that we need to be mindful of and try to prevent as best as possible. Some of the ways that we can prevent catching West Nile virus are, I know it's extremely hot, and it's not a popular idea, but really to wear long sleeves and long pants is one of the best ways to prevent against getting bitten by mosquitoes. So if as best as possible, I'm trying to do that. Using mosquito repellents is a great way to prevent against getting bitten by mosquitoes and then prevent West Nile virus. And then also to watch the surroundings that you go into, specifically the surroundings of your home. If there is standing water anywhere, for instance, we've had a lot of rain over the last month. If you have standing pools of water in empty pots, or just in any type of basin around your home, it is best to get rid of that water because the mosquitoes love that dirty water. And with that, I'm going to turn it back over to Dr. Max and myself to answer any questions that you all may have.
So before questions, I would like to add the fact that we're here to discuss aerial spraying. We have contracted through the Department of State Health Services, and we will be doing aerial spraying in a section of Harris County this weekend. Aerial spraying is one of the factors within an integrated mosquito control program that assists in controlling mosquitoes that can spread disease to the population. It's a quick, efficient way of knocking down adult mosquitoes that both pest mosquitoes, nuisance mosquitoes, and disease carrying mosquitoes in order to protect the residents from Harris County from vector-borne diseases. And this will be done this weekend. So if you have any questions, we are here to take those questions.
Yes, if you could, just as a reminder for our media partners, please use the raise hand feature and I will call on you. And we will start with Katiera. I hope I'm saying your name right.
Hello, my name's Katira Winfrey. I'm a reporter at KHOU 11 News. I wanted to see if there was a general idea where the majority of cases were happening or if it was an area that was getting more attention with the spraying and what that location is.
I think you have a question for both of us. Doc, you want to take the first part? I'll take the second part.
Well, so the first part with regard, I think your question is asking, I want to reiterate, your question is asking if there is a higher prevalence of positive cases. We don't have specific information right now about the prevalence of specific cases for human infection. We can get that information to you, but it will be in a general format because of HIPAA protection. But with regard to the positive mosquito cases, Dr. Vigilant can absolutely comment on that.
Right, so with positive mosquito cases, they are presented all over Harris County. And like I said, we separate Harris County into 268 operational areas. We have found 180 of those areas positive for West Nile virus. We treat those areas that are positive for West Nile virus, and we try to treat the surrounding areas. Based on our resources available at the time, we intend to treat each area at least 3 times, but we make sure that the positive area is treated and the surrounding area is treated based on the resources we have available.
Awesome, thank you. Jose, go ahead.
David Herrera with Univision Channel 45 in Houston. Wanted to ask you which areas specifically are they going to fumigate? It's just because most of the cases are happening on that area in Harris County, or you're planning to do in some other areas?
So the treatment is in the western part of Harris County, the northwestern part of Harris County, where we count in the operational area in the 900s. We call them around the back Katy area. We're still in the areas that we're seeing high numbers of mosquitoes after the storms. These are most of the areas that also have a lot of open space, open land, that's difficult to control from the ground spraying from our operations. So those are the areas that are high. These areas are also positive for West Nile virus, and they're also highly impacted by floodwater mosquitoes. So if we had a knockdown from aerial spraying, it assists in controlling the mosquito population in those areas.
Thank you, Dr. Vigilant. Katira, go ahead.
I guess what the question we both probably want to know, is there an area in particular that we should go to look at that has been primarily problematic? I know you mentioned 180 of the sites have found it, but maybe just a general area that we may go to figure out so we can get video for video purposes, really.
We have an interactive map in Harris County on our website that shows the areas that are positive for West Nile virus. It shows the areas that are going to be sprayed and the potential, the projected spray dates for those areas. This is a map on our website that's available. And like I said, if I say go to area 20, go area 21, but remember area 23, 25, 27, 30, 40 is also positive. So we're saying that we have 180 of those sections of Harris County positive for West Nile virus. And that's the areas that we're treating. And if you need to follow a vehicle at a site for treatment, you liaise with OC or our section department, and they can organize for someone to follow our vehicles or follow an inspector and take footage if you need footage for a media request.
All right, thank you. Katira, did you have a follow-up or was that an old hand?
It was a new hand. It was another question, but I can wait.
Go ahead with your question.
Okay. I know you all mentioned with the floodwater, it's been about a month since Beryl. Are these areas that are just heavily flooded? You know, a lot of places have dried out.
What's the question?
It related to Beryl. So I can provide the initial comment, and then Dr. Vigilant can follow up. So I want to be careful not to imply that the increase in positive mosquitoes that we're seeing is specifically because of Beryl. We are in a year where we expected to see an increase in West Nile virus, and I can hand it off to Dr. Vigilant to provide more explanation about that. But again, yes. I want to be clear that the increase that we're seeing is not specifically because of Beryl. Beryl, of course, because it was so much rain, didn't help, but the initial increase was not because of Beryl.
Right. So remember, we had 2 flood events. We had 2 rain events, heavy rain events, and we have a consistent periodic rainfall, sunshine, rainfall. Mosquitoes loves water and temperature. We have that impacting the operation. So what we have seen also is we had practically barely had a fall, and we had temperatures of 80 degrees in February. We had temperatures of 80 and 85 and 75 degrees in March. We had rainfall, and that temperature, it increased the number of mosquitoes. Now, floodwater mosquitoes usually present during midsummer. Right about now, we'd have a high number of floodwater mosquitoes because of rainfall. Floodwater mosquitoes overwinter in the egg stage in the egg stage, they overwinter during the winter time. What happened is the earlier rainfall, those eggs hatched earlier. This gave us a high volume of mosquitoes. We had the other event in April, I think it was. Then we had Beryl. Beryl came in with 2 factors though. Beryl blew out mosquitoes and also washed out mosquito larvae. But floodwater mosquitoes, because they lay, the mosquitoes lays in the soil, they lay in the grass, they lay out in the open field, they will present 5 to 7 days after a flood. So we see an increase after Beryl, but there was a high number of mosquitoes also before Beryl. So we can't blame Beryl for all of our situation right now in terms of mosquitoes. But environmental conditions, climate change has impacted how mosquitoes present different times of the year. And this is impacting the operations and impacting human health.
Thank you so much. I know we are getting close to the end here, so I just want to make sure we address Erica Smith from Houston Public Media. Her question was in the chat, and this is for Dr. Brown. She asked, of the 23 cases last month, it was said most of these human cases are people over 50 and one minor under 18. Can you clarify this for us now with the 23 cases? And then David, we'll get to your question after this.
Sure. So the only thing that I can confirm or will confirm at this time, again, to protect the health information, is that we do have cases that range from pediatrics up to age 65. The number of cases, I will say we have 7 females. We know of 7 females and 16 males, and again, ranging from the ages of 6 to 85.
Thank you, Dr. Brown. Go ahead, David, and that'll be our last question.
Yes, David Herrera with Channel 45. Wanted to ask you if there are any recommendations for the community whenever they're gonna fumigate. When that takes place, is there any precautions or anything that they should do? Stay indoors or what to do?
That's an important factor, that people should stay indoors as best as possible. Take your pets indoors. You cover up any if you have any animals outside, at least you can cover them during the period. The thing with the one of the facts with the pesticide being used, it's nailed or dibrome. It's on contact, aerial contact. It's sprayed from 300 feet up. It will contact mosquitoes and kill mosquitoes on contact. As soon as it hits the ground, 5 minutes, within 5 minutes of hitting the surface, it disintegrates, it breaks down. It breaks down very quickly. It's a very safe chemical to use. But it is also safe that individuals are indoors when this is taking place. If people are outdoors at the time and the airplane passes over, right after that, they should at least take a shower if they feel they were sprayed or if they feel that any of that pesticide fell on them. But that is a fact for individuals. They should stay indoors, cover up your if you have any pets that are outside, at least put a cover over it during the period. But just stay safe. Take kids, especially kids, take kids indoors during that period, and just stay safe to protect themselves.
All right, thank you so much. And with that, we are going to wrap up. Thank you again to Dr. Vigilant, Dr. Brown, and all of our media partners for joining us this afternoon. We ask all of you joining us today to please continue sharing information with the community about mosquito prevention and tips. We so appreciate it. Please visit our website at hcphtx.org for more information on mosquito-borne disease prevention and to view the dashboard of mosquito-borne disease human cases in our jurisdiction. And I put that link in the chat.
Alice, I can answer a quick question in the chat before I go.
Okay.
And yes, the spraying will be taken at night. Now, the effect of treatment is more effective to treat at night because that's when mosquitoes are out, and that's when bees and other pollinators are indoors. They're in the hives, and so they are protected because they're in hives and covered. But those mosquitoes are outside, and they can be impacted. Now, the other part about it is that the dibrome, the nail that we're using, it impacts mosquitoes, which are 2.5 to 10 milligrams in body weight. Bees, butterflies, and those, they are anywhere from 700 to 1,000 milligrams in body weight. So the impact, the effect of the pesticide on body weight is like you drink alcohol. Because the higher your stronger you are, maybe the more alcohol you may be able to drink compared to another person. So it's a body weight impacts how much or the effect of the chemical on the insect, and it's designed to take down mosquitoes, not other pollinators or other insects, because it's safe around food, it's safe around insects, it's safe around people. Thank you. I just wanted to answer that before we go. Okay.
Awesome. Thank you so much, Dr. Vigilant, for answering those last couple of questions. Yes, like I said, people can view maps of areas in our county where West Nile virus positive mosquito pools have been found at hcphtx.org/MC. Again, the recording of this meeting will be sent to everyone in attendance. And if you have any follow-up questions, please call our media line or email our media request email at mediarec.phs.hctx.net. Thank you again for joining us today and have a wonderful weekend.
Thank you.
Thank you,
Thank you
everyone.
all.
Thanks,
Bye-bye.
everybody.
Thank you.
All right.